What types of implants are best for hip replacement in a hip AVN patient? So first of all, it has to be understood that hip replacement is generally done for three kinds of patients. So number one are the hip fracture patients. Number two are the hip arthritis patients. And number three are the hip AVN patients. Out of these two, the hip AVN patients are the patients who are very young in age. These patients can be 20-year-old, 30s, 40s, or early 50s. Whereas the hip fracture patients, or hip arthritis patients, are normally in late 60s or 70s when they get a hip replacement done. So for the patients of hip AVN, because of their early age of 20s, 30s or 40s or early 50s, there is a high chance that if the hip replacement not done properly with a proper technique, or if the implant quality is not good, then they will need a replacement surgery, a revision replacement surgery after 15 to 20 years of the first surgery. So to avoid this kind of complication, avoid this kind of adverse event in your life, to avoid a revision replacement surgery in hip AVN, the very important decision rests upon choosing the right surgeon who does the surgery for you, choice of the right technique by the surgeon, which will automatically depend upon the surgeon you choose, and finally, the choice of implants, the type of implants that you use for the hip replacement surgery. So if you go by the classification of the implants for the hip replacement surgery, you can broadly classify them into cemented and uncemented. So the cemented are one which needs a bone cement, a kind of substance to fix the implant to the bone. And the uncemented ones are the more advanced implants. They do not need a cement to be fixed into the bone. So, on very basic terms, uncemented implants are always better than the cemented one. And at the same time, because they're better, they cost more than the cemented one. Now, coming among the uncemented implants, there can be choice in the material of the implant. It can be a completely metal implant, it can be a metal on poly, plastic type of material implant, or it can be a ceramic on poly, a ceramic material for the femoral head, and poly component, plastic component on the acetabular side. Out of these three, normally ceramic implants are considered the best for three important reasons. Number one, they give the smoothest surface for the hip joint to move. Secondly, the revision rate for the ceramic implants very less because their wear and tear is less. And third, their life is extremely long as compared to the other types of components. So talk about a hip AVN patient who has been advised a hip replacement surgery, and if he falls in the young age group, which normally happens, then they ideally should go for an uncemented hip replacement with a ceramic component of the femoral head, so that they probably will not need a revision hip replacement surgery, and in case they need it, it will be at least 25 to 30 years after the first surgery, depending upon the condition, the technique of the surgery was perfect enough. So, simply speaking, choosing your implants is a very important decision when you're going for a hip replacement surgery. Have a very good discussion with the specialist to choose the right implant for you, and do not hesitate to pay for more for the right implant so that you can avoid the future complications which can come with a poor quality of implant in the first hip replacement surgery.